Yeah, so good morning and good afternoon, everyone. It is my pleasure to welcome you all for this insightful discussion. And first, I would like to extend a warm welcome to Professor Sonu Goel, sir, Director RCTC and Professor at Department of Community Medicine School of Public Health, PGI Chandigarh. His dedication and strengthening healthcare system and his extensive research in public health has been a proud moment impact on the national and global health policies. So we are also honored to have with us Dr. Gopal Chauhan, State Program Officer NTCP under NHM Himachal Pradesh. So Dr. Chauhan is also instrumental in integrating digital approach for NCD prevention and control. His expertise in tobacco control and sustainable development goal. So also public health interventions. So additionally, it's my privilege to have Dr. Rakesh Gupta sir also. Sir is leading this webinar series. Sir is the President and Director of Public Health, Strategic Institute of Public Health Education and Research. His leadership and contribution in the field of public health have paved the way impactful policy reform and interventions. And thanks to our team Eco India also. I welcome Dr. Sanchika Gupta for their technical support and for guiding us to making this series of webinar more effective. And thanks to the participants who join us today for this important meeting webinar. And now I would like to invite Dr. Rakesh Gupta sir to introduce our guest of honors of the day.
Thank you, Rajiv. So I heartily welcome Dr. Sonu Goel. So he is our guest of honor for today's presentation. And he is a professor in community medicine and School of Public Health, PGI Chandigarh. So he has undertaken a lot of research projects and publications. Professor Goel has supervised over 50 national and international projects as a principal investigator and is currently leading 5 projects. Professor Goel has published more than 270 research articles in esteemed international peer-reviewed journals. And he has got a lot of awards and achievements to his credit. And work related to tobacco control, Professor Goel is the chair of tobacco control section and leads the Empower Research Group of the Union, as well as the NAMS task group on tobacco control. Additionally, Professor Goel is the director of the WHO Awardee Resource Center for Tobacco Control and the convener of the scientific support group established by the Ministry of Health and Family Welfare, Government of India. So over to Dr. Goel. Thank you.
Yeah, thank you, Rajiv and Dr. Gupta sir for introducing me and having a very generous introduction. So, Dr. Gupta and I share many similarities, and one of them is passionate about tobacco control. And we have been working together for now over 15 years now. We started work in tobacco in 2010 when I think Dr. Gupta was State Nodal Officer and I was in PGI. So we collaborated and then we collaborated on various endeavors. So thank you, sir, for introducing. And now I think over a period of years, I have seen that we have very good laws, very excellent laws we have. POTPA, very stringent law, very good provisions under the law. But when it comes to implementation, those things are weak. And this holds true not only for India, but also other countries, and especially the developing countries. In developed countries, we have a bit more stringent enforcement. But in developing countries, yes, I think we have weaker enforcement of law due to many reasons. Like, for example, lack of awareness. That is one reason why people don't. Then a casual attitude towards the law. And then about low knowledge and attitude. So these are some of the factors which, due to which we have poor enforcement of tobacco control laws or in fact any other law. So I believe, as a community physician, I believe in two approaches. One is health education approach, where we provide health education to people to abide with the law. And one is like a punitive approach, where the people can be fined if they don't abide by the laws. Right. So these are the two things which have been successful if we want to enforce any law, be it tobacco control. So so now we have to find out the models of such enforcement, because health is a state subject, and if any state accept a model for enforcement or do a model and run it successfully with outcomes, we all should replicate those models, or at least adapt those models based on our own settings. So that is why this webinar holds of very importance, because here Dr. Gopal Chauhan, a very seasoned researcher, a seasoned implementer, so we'll be talking about how in last 10 to 15 years such law has been enforced in Himachal Pradesh, and maybe when we as we are working in different states, we might like to adapt some of the things from the presentation. So before starting, I would like to congratulate Dr. Gupta for starting this very important series of webinar through Sipher, that is Models of Enforcement of Tobacco Control Act, on the 6th anniversary of Strategic Institute of Public Health Education and Research, again, which the organization which is growing growing immensely over a period of time, conducting a lot of capacity building sessions and webinars. So over to Dr. Akesh sir for I think further proceedings, and I look forward to attending this and seeing the inputs in the webinars.
So thank you, Dr. Sonu, for your introductory remarks, and we'll be waiting for your concluding remarks as well. So if you have some work or a meeting, you can just carry on with that. And at 1, you may join us again for your concluding remarks. Thank you. Thanks a lot. So over to Mr. Rajiv Chaudhary.
Yeah, thank you, sir. And now we'll move to our session, the speaker of the day, and Dr. Gopal Chauhan, sir. Sir is the State Program Officer, NTCP, Himachal Pradesh, and sir is the technical resource person for NCD, tobacco control, and SDGs with many states and state governments, and also the NGOs at national and international level. And he is the member of expert committee notified by Government of India for NCD in 2021, and he is presented paper in various national and international conferences, including USA, UK, France, Spain, Netherlands, Australia, South Africa, Hong Kong, Bangkok, and Nepal. And sir's key achievement is sir is the WHO CRO awardee for tobacco control in 2012. And sir is also a PM Digital Innovation Award holder 2018 for NCD. And sir has two second best in NPCDS in 2019 in the best practice meet, and also ranked the Himachal Pradesh state in the top in India for NPCDS review done by Government of India, WHO, and AIMS. And innovative strategies are implemented. An integrated approach for NCD prevention and control, and stroke care, and decentralized chemotherapy, palliative care, and health promoting education institution, and tobacco-free panchayat. So I think we are allowed to learn from this presentation. So over to Dr. Gopal Chauhan sir for their session.
I will be talking about the enforcement of the tobacco control law, which is known as Code Part 2003 today. Next, please.
Yeah, it is
briefly summarizing the global and national policies about tobacco control law, tobacco control legislations and policies. At national level, we are having National Health Policy, SDG Framework, Framework Convention, Treaty for Tobacco Control, Empower Policies, Tobacco Control Program, Code for 2003, specifically I will be talking about Code Part 2003 enforcement. And then we have multiple regulations. This Sports Tobacco Control, Food Safety Standard Act, Drug and Cosmetic Act, Electronic Cigarette Provision of Electronic Cigarette Act, Juvenile Justice Act, and Vendor License Act, and Municipality Act. Next, please. Yes, the COTPA 2003, the Indian Tobacco Control Act, it talks about demand and supply reduction, and the full name is the Cigarette and Other Tobacco Products Prohibition of Advertisement, Regulation of Trade, Commerce, Supply, Distribution, and Production, Supply, and Distribution Act, 2003. Next, please. This act are Section 4 talks about ban on smoking in public places. Section 6 talks about ban on sale to the minors by the minors, and we cannot sell tobacco within 100 yards of education institution as per the law. And the Section 5 says there should not be any direct or indirect advertisement of tobacco products. And Section 7 says there should be pack warning, which are specified by Government of India from time to time on tobacco packets. You cannot sell tobacco products without these pack warnings. But the most important thing is that there is a provision, Section 29 of this act, that the law enforcers are protected in a way that if their intention is to implement this law, but if something wrong is done by them, and which is in good spirit, then there should not be any prosecution against that law enforcement person in any court of the law in India. Next, please. Now coming to the provision which is Section 4 of this Tobacco Control Act, where we talk about ban on smoking in public places. It means if somebody is smoking in a public place, it is a clear violation of Section 4 of this Act. Then the question comes, what is a public place? Public place is a place where the public has access, whether it is a matter of right or not. It is something like that: park, bus stand, restaurant, hotels, and stadiums, airports, railway stations, etc. It is a violation if somebody is found smoking there. But if there is no smoking signage, there is no smoking signage, which is specified as per the Act, it is also a violation. It means that the in charge of the premises of a public place has to display the no smoking signage in the public place. Otherwise, he is liable to pay fine. If the signage is there, but it is not as per the law, if there is no mention of the name of the authority on that signage, that where the reporting of the violation has to be done, and if there is a presence of smoking aid, ashtray, etc. in the public place, maybe in a restaurant or hotel, and if the in charge of the premises is not acting on the violation, for example, somebody is smoking in a restaurant but the owner is not saying anything, it means the owner is liable to pay a fine equal to the number of offences. If the 5 persons are smoking in the restaurant, the in charge of the restaurant has to pay 1,000 fine. That is equal to the number of offences. And there are some exemptions also where the person can smoke. A hotel having more than 30 rooms, a restaurant having more than 30 capacity, and airports can have the designated smoking areas. But the specification has to be met as per the requirement of the Rule 2008. There should be a negative pressure. The smoke should not enter in other area and other to the visitors there, and there should not be any service in that designated area. Next, please. Next, please. Next, please. Next. Next. Yes, this is the signage. Previous one, sir. This is the signage which should be displayed in Hindi or English or in local language in every public place, and it is the responsibility of the in charge. If you find that this signage is not in public place, if you are a law enforcing agency, you can find that in charge of the premises. Next, please. We are having a very long list of law enforcers under Section 4, even every in charge of the public place, even Anganwadi worker, medical officer in charge of the PSC, everybody, school headmaster, every in charge of the, even the restaurant owner, all are authorized, but very few person are taking action on these violations, but we need to enforce the law if we want to see the result. Next, please. Next, please. Yes. Now talking about the section 6, which section 6 says that there should not be any sale to the minors by the minors and around the 100 yards of education institutions. But a signage has to be displayed in every education institution that the sale of tobacco products around 100 yards of this education institution is offense. Next, please. Next, please. Yes. Another violation is if the seller, tobacco vendor, is not displaying this signage. This is also a violation. It means that there are 3 kind of mandatory signages: no smoking, ban on no sale of tobacco within 100 yards of education institutions, and below 18 years. These 3 signages has to be displayed in the appropriate place. Otherwise, it is a violation of the law. Next, please. In schools, even school headmaster, principal, panchayat representatives, all are authorized to take action if somebody is selling tobacco products to the minors, by the minors, and around schools. Next, please. Yes, the punishment under section 4 and 6 is up to 200 rupees. It may be 50 rupees, 100 rupees. It depends upon the law enforcing agency that how poor the person is, can he pay fine or not. But the overall responsibility to make a place public smoke free is the responsibility of the in charge of that public place. For example, the hotel restaurant owner is responsible to make the restaurant smoke free. Next, please. Next, please. Yes. Now coming to the tougher kind of things. Section 4 and 6 are compoundable offences. But now I will be talking about the section 5. Previous slides. The common violation under section 5 are if there is a advertisement which is direct of tobacco products, the advertisement through TV, radio, electronic or print media, whatever we call. But these offences are non-compoundable, but they are available. Every case booked under section 5 will go to the court of law. I will tell you later that how prosecution is launched. Next, please. These are the few photographs of common violations. You cannot have such, colored, illuminated, and branded. You cannot put brand name on the, tobacco advertisement. Next, please. Next. These are all violations. Next. You cannot have smoking scenes. These are all, violations. Yes. Previous ones. Yes, this one. Next. 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 Yes. There is exemption that if somebody is selling tobacco, he can put this board, and 2 maximum boards are permissible in one place. It is a black and white board, size of 60 centimeter into 45 centimeter, where he can put these names only. Otherwise, he cannot put like Foursquare, like any brand product. It should be black and white board, and this is allowed in a tobacco selling shop, but no other board is allowed. Next, please. Yes, this is a very highly punishable offense. If somebody is found guilty of section 5 of COTPA, there is a imprisonment for 2 years or fine up to 1,000 rupees in the first conviction, and it may go up to 5,000 rupees and 5-year imprisonment for the subsequent second offense. Next, please. Now a little bit about section 5. Government of India has notified that there should be 85% pack warning, 60% picture, and 25% tax on each packet of tobacco product. This is again a bailable and non-compoundable offense. It means that the case will go to the court. Next, please. These are all violations because the specifications are not met. Next, please. Yes, this is the pack warning which should be displayed on each tobacco packet, otherwise it is a violation of the law. And next please. And there is a, under section 7, there is a punishment up to 5 years and fine up to 10,000 rupees. And it is a, again I told that it is a bailable, but it is a non-compoundable offense. Next please. If you seize these products, then you cannot retain these products under section 5 and 7 for more than 90 years. You have to take special permission from the judge, from the district judge, that the case is listed on this date. I need to retain these products, kindly allow me. Then the permission is granted. Law enforcers for section 5 and 7 are from police department, food officer, drug officer, excise officers, and others, superintendent, etc., and administrative officer. What are the enforcement tools? If you are going for enforcement of section 4, 5, 6, and 7, you should have, preferably you should make a team. You should not go alone. Otherwise, you are authorized to take action. You should have a challan book, because challan book is a procedure that how the case prosecution has to be launched in the court. If somebody is not paying fine, then the challan will go to the court like traffic challan. You should have a receipt book. There you have to give the receipt to the person after taking the fine. You should have seizure memo if you are seizing the material under section 5 and 7. You should have a complaint form. On that form, you will launch the prosecution to the court in the court of law. And there, if there are big boards and hoarding, then you can sign a surety bond with the Gram Panchayat Pradhan or some renowned person that, if this premises has been sealed, that you are the custodian of this premises as per the surety bond. You should have cloth, candle, matchbox, seal tape, etc., because you have to seal that material also. Next, please. This is the sample of challan. Next, please. This is the sample of receipt. Next. Now, under Food Safety Standard Act, many states in India, almost most of the states has banned this gutka. Gutka is mix of tobacco with pan masala, raw pan masala, but if they are mixed, we call that as a gutka. Gutka is banned. Canny is a gutka. Canny is a gutka because it is a mix of tobacco and this pan masala. What the companies are doing? They are selling these products in a separate pouch, and then we are not able to take action. Next, please. Yes, these are the state and district level committees which has to be notified under section 5, but they can act on each and every component of tobacco control. What we have done in the state, we have authorized this committee to take action against section 5, 7, and every kind of violations. Next, please. They are monitoring committees basically. Then we have the flying squads. At state level, we are having a team. At district level, we are having a team comprising officers from health, food, drug, and your excise persons are there. They are the flying squad. They are the teams. They go to the places. District level flying squad go to the different divisions, subdivisions of the district. The block level go to the different areas, different villages of that block for enforcement. Next, please. Then one of the things which we have done in Himachal Pradesh, that is we are using the fine collected as from tobacco violations for tobacco control in the state, because there is always scarcity of money for tobacco control. We are using this money for IC activities and for PUL, even for the vehicles when we are going for raid and ride, for marathons, for IC activities, for training purpose. This fund is being used. Next, please. Now, in 2019, the need was felt that electronic cigarette has been introduced by tobacco industry, and we don't have a specific law for that. Government of India enacted a very specific law, which is known as PECA, Prohibition of Electronic Cigarette Act 2019, which talks about there should be no production, manufacture, import, export, transport, sale, distribution, storage, and advertisement of electronic cigarette in India. It means that e-cigarette, if you find anywhere, it is a clear-cut violation. You can seize that. You can take the case to the court. The court will decide the minimum fine is 50,000 rupees for this violation. It means that there should not be any use, distribution, sale of electronic cigarette in India from 2019 onward. Next, please. Dr. Akhilesh Gupta from Chandigarh has done, you have done a wonderful job for this enactment of this legislation. Himachal Pradesh is having a very specific act that we cannot sell loose tobacco, single cigarette in Himachal Pradesh, and there should be not any vendor without vendor licensing. From 2016, we have started, licensing vendors in Himachal Pradesh, and you will see next, in few years that nobody can sell tobacco in Himachal Pradesh without those, licenses. We started tobacco control in Himachal Pradesh in 2009. We involved the senior bureaucrats, senior, chief minister, politicians in a campaign mode. Next, please. And then in 2010, we made Shimla city as the first smoke-free city, which was evidence-based. Although two cities, Chandigarh and this Jhunjhunu, were declared before Shimla city as smoke-free, but the evidence-based Shimla is the first evidence-based smoke-free city. Next, please. Then we started multiple, campaigns, signature campaign by Health Minister. Next, please. We awarded all those people, those who were working for tobacco control through Chief Minister of Himachal Pradesh from time to time. Next, please. And in 2010, the day came when one of the villages in Himachal Pradesh, they declared themselves as tobacco free. Then we did the assessment that there was no use, no sale, no entry of any tobacco products in that area. And till date, we are able to sustain the tobacco free status of this village. Next, please. We awarded the villagers, the Gram Panchayat Pradhan and the villagers through Chief Minister of Himachal Pradesh for making that villages tobacco free. Next, please. Then we got the WHO award for tobacco control in 2011 for NGO and in 2012 for state government in Himachal Pradesh. Next, please. In 2013, we made and we declared the entire state of Himachal Pradesh as smoke-free. Smoke-free does not mean that nobody is smoking in Himachal Pradesh, but the public places up to 90% are smoke-free. This was the criteria. Next, please. Yes, we try to increase the taxes on tobacco products from time to time before GST. Next, please. We are having the state-specific tobacco free education institution guidelines and tobacco free panchayat guidelines. The guidelines are there from Government of India also for schools, but we have a third-party evaluation system for schools, and there is a cash award of 5 lakh rupees if a panchayat achieves tobacco free status. We have done the assessment in more than 1,000 panchayats in Himachal Pradesh, and 2 panchayat has qualified to be certified as tobacco free. Next, please. These are the campaign, tobacco free campaign in schools and various levels. Next, please. This is the state level, coordination committee. Next, please. This is the reporting which we are collecting on monthly basis from the field. That what was the target of our schools, that where the workshops has to be organized about the tobacco free, how many has been done and how many has been declared out of that as tobacco free, how many panchayat has been covered and how many has been declared as tobacco free, and in how many panchayat the work is going on, how many enforcement is happening, and how many persons are availing the tobacco cessation services. This is the monthly reporting format which we are collecting from the districts, and districts are collecting from the sub-district level. Next, please. And in Himachal Pradesh, we have launched prosecutions and we have convicted people for violation of Section 5 and 7. Not only for direct advertisement, even for indirect advertisement. We know the mechanism that how the cases will go to the court. The flying squad will visit, they will seize the material, they will do the photography, they will fill up the challan form, they will fill up the complaint form, the seizure memo, then the case will land to the court. They are the violation of section 5 and 7, and then there is the case is listed in the court, and then finally the judgment comes. There is also a imprisonment has been awarded to persons in the state of Himachal Pradesh for violation of section 5 and 7. Next, please. This is the summary of the activities what we have done. Next, please. I have already explained most of the things. This is the challan and the fine being collected as from the violators, which is being used for tobacco control activities in the state of Himachal Pradesh. Next, please. From 2010 to 2014, we are collecting this information. As per GATS, there is a substantial decline in tobacco use in Himachal Pradesh. It has came down from 21 to 16%. Next, please. Next, please. Yes, as per GYTS, we are previous one, sir. We are having the lowest prevalence of tobacco use amongst school children from 13 to 15 year age group. It means that our school-based tobacco control program is, showing impact. Next, please. We also received the WHO award in 2013 for tobacco control. Next, please. This is how the political system is involved in tobacco control. Next, please. Himachal was awarded for tobacco free youth campaign in 2023. The results for 24 is just to come. Next, please. This is a unique thing. We have done a study that there is a reduction in tobacco use. Whether there is a reduction in tobacco-related diseases due to tobacco control in Himachal Pradesh or not, it is under publication. But I have, shown the preliminary findings. Yes, we can say that due to tobacco control, there is an impact on tobacco-related diseases, and the tobacco-related diseases are coming down in the state of Himachal Pradesh. This is the first study of its own kind in entire India. Next, please. The key achievement, I have already enlisted all those things. Next, please. These are the decision of the latest state level coordination committee 24 that we need to achieve tobacco free education institution, tobacco free panchayat, vendor licensing, hookah bars has to be curtailed, tobacco association should be focus area, indirect advertisement, smuggled tobacco, e-cigarette ban, reconstitution of flying squad, and health promotion policy. They are all within the ambient of this tobacco control program. We have very clear targets. In 2010, the tobacco use was 22%. As per GATS 2016, it has came down to 16%. The current tobacco use is 11.6%. The target for 2025 is below 10% by 2025, and we need to reduce it below 5% by 2030. This is our SDG target, and we are working very, comprehensively and very minutely to achieve these targets. Next, please. I think that's all from my side, that how Himachal Pradesh is progressing, how the law is being enforced, and how we are utilizing the fund for tobacco control. Thank you very much.
So, thank you, Dr. Gopal Chauhan.
Thank
for
you.
the wonderful presentation.
Yes, sir.
Yeah. Thank you, Doctor. Can you stop share? Have you stopped sharing, Rajiv?
Yes, sir.
Okay.
I stopped share, sir.
Okay. So Dr. Gopal, actually he had to go for a
Sir.
BIP meeting, but he shared with us the presentation by recording itself. So it was a wonderful presentation, and I think he is one of the best implementers in India. So we can, at least in North India, we can think of. And he told us all about the provisions in the Act, COTPA, various sections of the COTPA, and other related anti-tobacco and nicotine acts, and how they are implementing the law. He also showed us the signages which are mandatory to be there for the smoke-free law and for the other laws. And he also told about the provision of the provisions if a violator is there. Then he told about how they are implementing TOFI guidelines, TVL, that is tobacco vendors licensing, tobacco-free villages. He also told us about the enforcement tools. We need to have a team, team squad. We need to have orders from the government and the team lead. Then he also showed us the challan book, receipt book, the Caesar the memo, and complaint form. Surety bond form was also shown. Then he also told that we need to have cloth, candles, matchsticks, and he went to very minutely and what a enforcement squad need to have. So that is why they were awarded twice World No Tobacco Day Award, the Himachal Pradesh under his leadership. He also told us about the state level coordination committee and what are their functions and what are the members. And they have a digital app in Himachal Pradesh. So we have a real time actual prevalence of the tobacco control and all non communicable diseases. So I think it was a wonderful presentation, and we all need to learn about them. This presentation we will share in the Sipher Health News, our YouTube channel. So all those who could not attend, and even those who could attend, they can just go to the presentation and just watch it again. And they have put a target 2030, the 5% prevalence of the tobacco. So tobacco prevalence. So I think that is it is an achievable target with them, at least the way they are implementing the law. So thanks a lot. And Rajiv, we have many experts in the audience. Can you just acknowledge the presence? Thank you. Rajiv, are you muted?
Thank you, sir.
Yeah.
So, is there any questions? So, with us, Dr. Rakesh.
Please acknowledge the presence of the experts
also. I have seen Dr. Yes, sir. We have with us Dr. Rana J. Sipher from Vital Strategy.
We have Dr. Ashima Sareen also from the Hon'ble Foundation.
Mr. Narendra and Dr. K.C. Sani, sir.
Yeah. Dr. Siddhi Hathiwala is also
there. Is there any questions on? Yes, sir. So, any questions on this presentation?
Or Rajay, before the questions, I think we can have expert comments of the people who are here, the subject experts we have with us. So Dr. Rana, you can please give your expert comments.
Sure, sir. Yes, sir.
Dr. Rana, are you still with us?
Yes, Dr. Gupta ji.
Yeah.
Am I audible?
Yeah, you are audible.
Yes. So thank you very much, Dr. Rakesh, Dr. Gopal Chauhan, Rajiv ji, and all the participants who are here. Thanks to Sipher for organizing this webinar on very important issue of enforcement of tobacco control or nicotine laws. You see, I am perhaps the only person who is witness to tobacco laws enforcement in the country in almost 20 plus states. When first challan or first penalties were made to violators of various provisions of tobacco control law, that is COTPA. The first challan done in many states, including Himachal Pradesh. So perhaps similarly in Tamil Nadu, Rajasthan, in many states, I was part of that first enforcement efforts. enforcement mechanism. At that time, everyone was thinking how to enforce this law. There was no law manual. There was a law, but how to do that? How to enforce the law? That mechanism was not there. So we developed various mechanism for various provisions of COTPA, how to enforce Section 4, 5, 6, 7. So in between, many experts, many people joined, including Dr. Gopal Chauhan, Dr. Gesh Gupta ji, many people from southern states. So one by one, and in northeastern states. So an enforcement mechanism is very crucial. So what does that enforcement? There was no challan form. There was no seat book at that time. So we established enforcement mechanism in almost every state. We worked with the local authorities, with the state tobacco control cell, and constituted enforcement squads. There should be challan forms, designed challan forms. Delhi was perhaps a state from where I learned a lot from the then nodal officer, Dr. R.P. Vashishta, who was very good in enforcement activities. So Delhi was doing a good work as far as enforcement is concerned. So there should be a head of account where challan money can be deposited. There should be some mobility support in the form of a vehicle. So all that was developed in different states. Then at district level, so that was the enforcement mechanism which was developed to start enforcement activities. Currently, now, if you ask me what is the situation today, you see the tobacco control laws enforcement, various provisions that is variable across the country. Section 4 and Section 6A and B were very easy, relatively easy, I would say, because they are compoundable offense. These are the cases which normally do not go to the court. So, compoundable offense and case finishes then and there when some violator pay the fine, case is closed. But some cases where people do not pay the fine on the spot, the case may go to the court. So Section 4, that is smoke-free policies, was the most important and favorable provisions of COTPA, which was quickly grasped by the state governments, and they said that yes, we will implement this. Slowly, one by one, many cities achieved high level of compliance. No smoking signages were displayed across the country at the district level, across in public places. So many cities they started enforcement of the legislation. Section 4, 6A again it was relatively 6B, 100 yards, no sale of tobacco. That was relatively a little bit. It had challenges at that time, but slowly the things are improving. Section 5 and 7, Dr. Gopal has already shared that Himachal Pradesh was the first state to make prosecutions in TAPS ban and Section 7 of COTPA. So what is the procedure to be adopted? So it's not possible to right now to share with you at this time how to enforce provisions of Section 5 and 7, where the penalty can be in cash, it can be fine, or it can be imprisonment also. So in that way, enforcement is variable. Still, within the state, some districts are doing good. So it is, you can say that it is sometimes personality driven. The local authorities initiative, which is an important factor as far as enforcement of the laws is concerned. I learned a very important thing at that time, that any law, tobacco control law, becomes self-enforcing once people are aware. Please try to understand, once people are aware that there is a law. So it's very important to make people aware that there is a law. Secondly, when people are aware that someone from enforcement agencies is looking at them, that there is an enforcement agency. So then law becomes self-enforcing. Then we do not have to challan, penalize millions of people in a big country like ours. So we need to see that these two things. So for that, public education is very important. So in the beginning, government of India did a few campaigns also, where smoke-free policies, they were informed to the general public through mass media campaigns, through the local level efforts, through the local level IC activities. So that is very crucial. And then enforcement. No, you see, people often say whether enforcement is required or simple education. No. Yes, we can do education programs, but at the same time, there is a law. It has to be enforced. There is no alternative. People often say that let's educate the people. Okay, please educate the people. No problem if you have budget. But actual enforcement at the grassroots level need to happen if you want to achieve high level of compliance and ultimately reduce tobacco use prevalence in any setting or in the country or at state level. There are, I can say so many things, but I think we need to listen from you people. Challenges, yes. Multi-stakeholder engagement is a challenge. COTPA has authorized, for example, smoke-free policy. COTPA has authorized 21 government departments, various officials of the rank of sub-inspector and above, who can penalize a violator of smoke-free policy, smoking at any public place. But very few departments are involved. So mainly it's health, which is doing, and then it is police department, which is contributing little bit of support from urban development, that is municipal corporations, and some support from education department. So these are the four major departments. Little bit in different cities or states, maybe transport and tourism, but not all other departments. They are contributing to the enforcement efforts. So multi-stakeholder engagement, that is involvement of all departments, is really it's a challenge. Uh, Secondly, maybe availability of mobility sport. That is another challenge sometimes, that they have multiple responsibility, people say. So this is as such, but there are other things also, that how to monitor tobacco enforcement policies, tobacco law enforcement policy, and opinion polls. Opinion polls were very crucial. When we started here in the country, we did many opinion polls, even in Punjab, where Dr. Rakesh Gupta, in city of Mohali, in city of Mansa, opinion polls, what public wants, even in city of Shimla, what public wants. So you will be surprised that there was huge support for enforcement of smoke-free policies. People want that their cities, their states should be smoke-free. Even tobacco user, it was seen that even there was almost similar kind of support, that even tobacco user, even the smoker, they also want that public places, that I want to go to any public place with my family which is smoke-free. So there was huge support. These compliance, these opinion polls were shared with the local administrations, local political leadership, that please see, people of Shimla wants Shimla to be smoke free. People of Mohali want it to be a smoke free. So public support is so all enforcement efforts should be supported by public support also. And secondly, compliance assessment studies. So till date, we have done almost 400 plus compliance assessment studies with the sport, in collaboration with the various state governments, state tobacco control cell, NGOs, academia, even in Punjab. Almost there are 22 districts. So many compliance assessment studies were done earlier with our collaboration. Thereafter, Dr. Kesh Gupta and team Smoke Free, they did their compliance assessment studies with the support from PGIMER Chandigarh in collaboration with. Similarly, in Himachal Pradesh, in almost every state, so compliance assessment study is very important. What is the compliance to section 4, 5, 6, 7? And we need to achieve as high. 100% we cannot achieve, but definitely we need to achieve compliance to policies, to laws up to 90%, where we can declare smoke-free district or smoke-free city. We can declare it taps-free district. We can declare whole tobacco compliant district, tobacco law. COTPA compliant district. So in that way, we can do compliance assessment studies also. So in short, all compliance enforcement activities should be supported by these additional things. That is opinion polls. Even in Shimla, we have done. What is the impact when people do not smoke at a public place? What happens at homes? So we saw that in Himachal Pradesh, in the city of Shimla, the compliance the smoking at homes have also reduced. So when any city goes smoke free, becomes smoke free, the homes in that city also adopt smoke free policies, and people and smokers do not home. So we compared Shimla with the city of Haridwar, which was not a smoke free city at that time. So in that way, law enforcement is very crucial. So simply, we need to see that enforcement mechanism is established across the country. Still, there are districts who have not done even or very few, one, two, three, or maybe few in tens number of penalties. So there are challenges. So would request all the states and all the people who are involved, all the stakeholders, that enforcement of legislation is important component if we ultimately want to reduce tobacco use prevalence. So thank you very much, Dr. Gupta, once again,
Yeah,
and good
thank you, Dr.
afternoon,
Rana.
Professor Goel. Thank you very much.
Yeah.
And maybe when Dr. Gopal Chauhan is not here, so maybe if there are one or two questions, so I will be also happy to respond.
Yes, yes. So thank you. And I may tell you that Dr. Rana is mentor to many in tobacco control, including myself. And he is an expert in tobacco control laws and their implementation. So I think we'll be happy to hear from you again, Dr. Rana, if there are any questions. But before we listen to the concluding remarks of Dr. Sonu, so we have Dr. Ashima Sareen with us from the Sambandh Foundation. So let's listen to her. Any remarks, Dr. Ashima? Dr. Sani? Dr. Sani from Rajasthan. We have Dr. Siddhi Hathiwal also. So, any comments from these experts?
Yes,
Dr.
sir.
Sani
Thank you.
Saab is there.
Yeah. Thank you, Dr. Sani, Mr. Sani. Hanji Sani Saab, boliye.
It was a very nice presentation because I am also involved in the implementation program in Rajasthan Pali district. So I am very much delighted to have such kind of presentation in a national level platform. So thank you for joining me here, sir. Thanks a lot, sir. It was nice presentation, sir.
So thank you, Sani sir. So Dr. Ashima, are you there with us? Dr. Ashima, Dr. Siddhi. So otherwise, I think we can have concluding remarks from Dr. Sonu Goel.
So thank you, Dr. Rakesh, and thank you, Namaskar, Dr. Rana sir.
Hello, sir.
Namaskar, sir. So I think I hope that every one of you have liked the passion of Dr. Gopal. So Dr. Gopal is still a passionate tobacco control crusader, and I think a lot of things to learn from him. So what three things which I feel is really important if we want to enforce the Tobacco Control Act? Number one is a good institutional mechanism, the tobacco control institutional mechanism. Like, for example, state level coordination committee, district level coordination committee with all the members should be there. So first see if in case, although I think 90% of the places we have these mechanisms, but still see that whether these mechanisms are in place at your state or not. The second is, although 90% of people might be having institutional mechanism, but you might not be conducting regular meetings of people. So second thing which I feel is very important is regular state level coordination committee, district level coordination committee meetings. So at least I feel that every 3 months should be a SLCC should be there. So, and similarly, district level coordination committee should be there. And more so, important is not only the health department, but all the other departments should be present in that meeting. In case it is not, please request your secretary to write a DO letter to every individual or the members, so that they can feel the seriousness of these committees, the presence. Because sometimes the junior level official comes in those meetings, which decreases the sanctity of those meetings. So second is that all the people who are stakeholders, police people, excise taxation, urban health, education department, all the people should be present in those meetings. Number 3 is multi-sectoral approach. Because tobacco control, if even health department goes to a place to do challan, nobody will listen. But if police people goes along with, or any other individual, like for example, I have seen in Punjab, meteorology department, when Dr. Rakesh was state nodal officer, meteorology department people, weighing. So they also go along with. And there is a huge challan for meteorology. One challan costed 5,000 rupees. Our Kotpa currently has a challan maximum of 200 rupees for a punishment. But there, so I think 5,000. So main thing is multi-sectoral approach should be there. NGO, academia, government people, all should be there. The role of academia is very important. Also very important. NGOs definitely drives the program. That is real, in real sense. The government people support them, and academia support in terms of doing state level research, some policy focused research. I was hearing Dr. Rana that opinion poll, when we conducted opinion poll and way back in 2009-10. So it was a very, I think, very well taken by policy people, that people want that there should not be any smoking. Initially opinion poll and then compliance monitoring surveys. So that is again very important. Evidence generation for the state is really very important. So these are the 3 things I think initially, if you do, and these are not very difficult things. If you do, then I think we can have a proper enforcement mechanism of the law, which is already there. Now enforcement is there in our hand. Government has already done that. Government has made the law, but enforcement and everything is there in our hand. We can always do it if we have a will to do that. So thank you very much, Dr. Rakesh, Dr. Rana sir, for I think being present here, and Dr. Gopal in absentia for that very passionate presentation, as he usually do the work in their states. So thank you.
So thank you, Dr. Sonu, for your concluding remarks. And if anybody still has any question about the implementation of the laws, so they are welcome to ask Dr. Rana. He is here.
No. Please also share your experience. For example, what is the current challenge you are facing? Any suggestion how to make it more easy or compliant or self-enforcing? Any koi bhi suggestion hai? Because it's very important.
Before any suggestion, I think I'd like to share my personal experience in Himachal Pradesh. We were actually attending a conference there. So Dr. Sonu was there, Dr. Swasti was there, and me. So 3 of us, we were just going to a restaurant to listen to commentary, our cricket commentary. And then we saw that in that restaurant, there were some people smoking. We just requested the manager to please stop these people who are smoking, but they did not stop. So we sent a complaint to Dr. Gopal John. I just made a phone call to Dr. Gopal that please do something about it. And within 5 minutes, actually, less than 5 minutes, a sub-inspector along with 2 constables, he came and he actually challaned the violators. And along with the violators, there were 10 violators, they were challaned 200 rupees each. Along with the violator, the manager of the restaurant was also challaned 200 into 10. So I think that is important. If the state nodal officer is very proactive and the response time was so impressive, we were actually impressed by the kind of implementation in the Himachal Pradesh. So, what else did you ask, Dr. Rana?
No. Any suggestion, any experience from the participant related to enforcement? Any
Yeah.
questions?
So I think we must make use of other laws also, in addition to the COTPA, like PICA, the Drug and Cosmetic Act, the Food Safety Act, the Juvenile Justice Act, and as Dr. Sonu told you that we use the Legal Metrology Act also to our advantage, and lot of challans were done under Legal Metrology Act, and many of these illicit products, they were not having that warning on it, and they were not as per the Legal Metrology Act. So and they were seized and they were challaned actually. Immediately, you could recover money from them. So I think that was a good point that Dr. Sono reminded me that we did that much. And the assessment studies, yeah. And the use of academia also was there in Punjab. So I think it must be there in Himachal Pradesh also. Dr. Gopal never mentioned about the academia, but we use it to our advantage. Definitely in all the state level coordination committee meetings. So Dr. Sonu was a regular member.
Yes. So in Himachal Pradesh, they also participated in conducting various compliance studies. So Himachal Pradesh University and Public Health Department or Community Medicine Department of Indira Gandhi Medical College. So they conducted compliance assessment studies in various districts of Himachal Pradesh in early phase. Thereafter, government also get it done through their own teams of health workers, because they conducted series of compliance assessment studies. It was not so in that way, yes, that involvement was there. So best combination is when government, civil society, and academia they work collectively. So I think things become much easier.
Yeah. And moreover, as Dr. Sonu pointed out, that we must have regular meetings of the SLCC, DCCC, DTCC, so that and the senior most people should attend these meetings, and they should be asked about the number of challans which have been undertaken by them, and any other activity in tobacco control they have undertaken last month or when the last meeting was held. So it really makes an impact.
Maybe last comment from Dr. K.C. Sani, sir, anything on enforcement? Any experience? Are you involved in enforcement activities also? Do you go to or maybe have seen the challaning activities?
Sani sir, can you tell us about the hookah?
Sir, mute hai aapka. It's muted.
Sorry. Thank you, sir. सर मैं कोर्ट पर एनफोर्समेंट में भी इन्वॉल्व हूँ और सीजेशन में दोनों में इन्वॉल्व हूँ, बट अनफॉर्चुनेटली सर मैं जिस जिले में काम करता हूँ, हमारे जो डिस्ट्रिक्ट कलेक्टर है वो खुद टोबैको यूज करते हैं सर, तो वो डीएलसीसी की जब भी बात करते हैं तो वो कुछ तैयार ही नहीं होता उसके लिए, और ठीक है यार देखेंगे, लेट्स सी। तो सर सरकार को भी सोचना चाहिए इस तरह की कोई लेटर्स आए कि कलेक्टर लेवल के जो ऑफिसर्स हैं कम से कम वो तो टोबैको बंद करें। मैंने एक दो बार टोबैको बंद करवाने के लिए, बट बिल्कुल लाइटली लिया, उन्होंने हंस के टाल दिया, ठीक है ओके देखेंगे लेट्स सी। तो सर दिक्कत ये है कि हम लोग जब चलानिंग में जाते हैं, पुलिस हमारे साथ में होती नहीं है, कई बार ऑकवर्ड सिचुएशन में हम लोग आ जाते हैं और हमको बिना चालान किए वापस आना पड़ता है, और समटाइम वी फील इंसल्टेड आल्सो।
नहीं, then in tobacco, अभी जो tobacco recently there was tobacco free youth campaign too.
Yes sir.
So how many penalties were reported from your office?
Sir, from my district there was I think 5,000 challans were there during
5,000 challans.
5,000.
So whether they were really challans done by health or police or
no, exclusively from health department.
So 5,000 challans were done by your department.
Police didn't support us, sir, in chalaning activities, sir.
So these are the challenges. So this is what we wanted to know from you. Secondly, sir, regarding sometimes our officials, higher officials, using tobacco. So my submission is, so although it's a challenge little bit, but still we do not go by that thinking that we will not work. So I have seen in the past, in that at that time, almost 20 years or maybe 18 years back, many secretaries or even many politicians, so they were using tobacco. But anyhow, sometimes they were reluctant to come to various meetings. That what message I will give. But there is an effort that goes, okay, sir, you please share on that meeting that I am a tobacco user, but I am trying to quit. So this is also important message, even if it comes from a politician or so. I have seen in the past such things, initial challenges. But anyhow, please continue, and I think we always find a lot of work from your
best
district
in
of
the
Hon'ble.
district, sir.
Thank
Sir,
you.
for your kind information, I will like to share my personal experience. One more experience, sir. Sir, I am a cancer survivor. I had an
Yes.
cancer in 2012, and then that was due to tobacco chewing. So that's why I am involved in this program for suggestion and enforcement.
But that is experience. So such things, such messages can also come from those people who are, even if they are currently using.
Yeah.
That currently I am a user, but I am trying to quit. मैं छोड़ने की कोशिश कर रहा हूँ. वो भी positive messages हैं. Okay, so this is again something so that is also, sir, very important. And we always say a cured patient is a best pamphlet. So आपने अभी वो आज संजय जी और वो नहीं है, अभी वो आशिमा, डॉक्टर आशिमा को देख रहे थे. So there is you must have seen that program, Voice of Tobacco Victim. So where Mr. I think a campaign spearheaded by Tata Memorial Center. So where a person who has gone through those sufferings, so when they share their experience, so it has also very positive impact. And you are now really motivated, sir. Thank you very much. Thank you.
So Rajiv, I think we can have a group photograph, a snapshot before we listen to the formal vote of thanks from Tamanna here.
Sure, sir. So we request all participants and experts to switch on your video for next 2-3 minutes. And in the meantime, we can ask Tamanna to propose official vote of thanks. Over to Tamanna.
So all are requested to please open up their videos. Thank you. आप snapshot ले लोगे तुझे?
Yes, sir. Yes, sir. Yes, definitely.
Ajay, Tamanna, are you with us?
Yes, sir.
Okay.
Good afternoon, everyone. So, as we come to the conclusion of this insightful and engaging webinar, it is my honor to extend a heartfelt vote of thanks to everyone who made this session a success. First and foremost, our deepest gratitude to Dr. Sonu Goel and Dr. Gopal Chauhan for sharing their invaluable expertise and experiences. Your contributions to public health, non-communicable disease prevention, and policy implementation continue to inspire and drive meaningful change. A special thank you to Dr. Rakesh Gupta for his leadership and his public health research and advocacy. Thanks to Dr. Sanchita Gupta for Eco India for her technical support. Also, we extend our heartfelt gratitude to the esteemed guests for joining us today. A special welcome to Dr. Ashima from Sambandh Foundation, Mr. K.C. Saini from Rajasthan, Dr. Siddhi, Dr. Narendra from Seeds, and also Dr. Rana J. Singh, staff of Faith Foundation. And we surely appreciate your valuable time and contribution. And I also want to thank all of our participants for enthusiasm, thoughtful questions, and active engagement that they made during this webinar. We hope today's discussion have provided invaluable knowledge that can be applied in your respective fields. Let's continue to collaborate, learn, and work towards strengthening public health initiatives. Thank you once again. We look forward for future discussions.
So thank you all. Thank you.
Thank you very
Thank you.
much.
Thank you. Thank you.